In this video, I'm going to briefly talk about newborn reflexes. Reflexes. What exactly is a reflex? This is different than your controlled, effortful behaviors that we're going to talk about when we talk about motor development. Reflexes are things you just do without thinking about them, often without having to learn how to do them. They are reflexive, they are innate, not learned behaviors. Very specific, involuntary, that's the word I'm looking for, involuntary responses. And an infant with healthy brain development or typical brain development will be born with certain reflexes already in place. They don't have to be taught to do certain things. Like as one example, you put something in their mouth, they're going to start sucking on it reflexively. They don't have to learn their sucking behavior, what we call the sucking reflex, and that's good for survival. They can start eating right away without having to be taught. A lot of reflexes are linked to survival. One way that I demonstrate reflexes in the classroom, it doesn't work very well for a video, but typically the computer that is attached to the overhead projector in my classrooms has a big metal door on it. It's encased in a metal door, and so I'll act like I'm going to get the eraser or something, and I'll just slam that metal door, and then all of a sudden students are like, what the heck? Why did you make my heart go up like that? And I'll say, okay, we just demonstrated your startle reflex. They're like, okay, you didn't have to learn how to do that, and you didn't have to think about it. You just did it. So it is involuntary. So that's a good example of a reflex. Infants have a startle reflex too. In fact, they've got a fancy version called the Moro startle reflex, where they don't just go, they fan their arms and legs out, and then they bring them back to center. And so that's when you see that, when you see this reflex in an infant when they're at the age where you expect to see it, that's typically seen as a sign of healthy brain development. Now, there are other reflexes, and a lot of them work best if you see a video of them. If you see a video of an infant actually performing that behavior, that's part of the reflex. All right, so what I'm going to do for my students and anybody watching this video, I am going to link to another video, possibly more than one, or other videos, or maybe one video, but another video showing, actually demonstrating or showing these reflexes, because it just works best to see them. But all of these reflexes, they are going to be involuntary. They're going to be a sign of healthy brain development. Some of them do disappear after a certain amount of time. Like, for example, there is one reflex called the Babinski Reflex, where if you brush something against the side of the little baby foot, they will fan out their toes. All right, that is a normal behavior, or normal reflex, normal response in the first 6 months of life, but it disappears after the first 6 months. If you see that after that, if you see that like an adult, it's actually a bad sign. They test for it in the emergency room when they're concerned for like cerebrospinal damage. All right, so some of these reflexes, like your startle reflex, you keep that one. Other ones will disappear as you mature, as you get older.